Hi, welcome everyone. We're going to wait a few minutes to let everyone join and then get started. Okay, welcome everybody. I am Martha Scarborough, Regional Resource Director for Caron Treatment Centers, serving Georgia, Tennessee, and Arizona. Thanks so much for joining us. This is our 21st installment in our webinar series, A View from the Mountain, Caron's perspective on addiction treatment in the wake of COVID-19, and today's topic is Caregiving, Career, and COVID-19, helping women connect and cope during a worldwide crisis. And today's presentation is eligible for 1 continuing education credit. We want to thank our educational partner, CE Learning Systems, for assisting and providing these credits through co-sponsorship with the American Psychological Association. Our process this week will be a little bit different from our past webinars. A link to the evaluation will be emailed directly to you after the presentation. And after finishing the evaluation, you'll have immediate access to your certificate of completion. And just as a reminder, you must be on for the duration of the presentation in order to receive credit. We will be conducting this session in webinar format. All participant microphones will be muted. During the presentation, please utilize our Q&A feature to ask any questions that you might have. Depending on the volume of questions, if we can't get to your question before the end of the hour, we'll have someone from our team follow up with you directly to get your question answered. And today we're actually expecting to have 2 presenters, Erin Goodhart and Samantha Smith. Unfortunately, Samantha had a family emergency, so she was unable to join us. So Erin will be our sole presenter. Erin Goodhart is our Senior Clinical Director of Women's Services at Caron. She has been with Caron since 2004 and currently has clinical and administrative oversight over all our women's programming and family services. She's also an adjunct professor at Alvernia University in the Behavioral Health Department. And Erin is very passionate about helping women and families overcome the stigma and shame and barriers that keep them from seeking treatment and engaging in active recovery. So with that, I'll turn it over to Erin. Welcome.
Thanks, Martha. I'm glad to be here. All right, well, good morning for most of us. As Martha said, my name's Erin. I am very glad to be here. So this time together, we're going to discuss all issues related to women that we can in this amount of time. Really, our goal in this is to talk about substance use in women in general, look at some of the signs and symptoms that crop up for women who have substance use disorders. And really also, the bulk of this is going to be focused on understanding the specific treatment needs for women in recovery in treatment centers, and then also really sort of managing this time of additional stress related to COVID precautions. I've been, I'm active on social media. I'm really seeing these outcries of need from women managing working from home, being a stay-at-home mom in school, and just trying to keep it all together. So, we're going to spend some time talking about that this morning also. What I wanted to really start with, though, is looking at some of the challenges that women face coming into treatment. And when I use the word treatment, I'm really sort of using that loosely. I'm using that in outpatient care, individual therapy, residential treatment, because the women that I've worked with and what we see in terms of trends is it's very difficult for women to seek treatment. And if we look at some of the challenges, we really look at addiction is really based on self-report. And a lot of the women that seek treatment are sort of high functioning or can be high functioning. And it's hard to get a gauge of how much is sort of quote unquote normal drinking or normal substance use versus when it crosses that line of becoming problematic. It's very subjective. What's appropriate or allowed in one culture might be very different in another environment. Addiction, varies from population and time. If we look at sort of some of the recent trends, we think about the opiate epidemic. We think about all these new research articles and these sort of opinions coming out around substance use as it relates to COVID-19. That it's not as that it's happening more secretively, and that it's perhaps progressing in lots of different ways. Addiction symptoms can be subtle, especially in women. It's a little more culturally acceptable for men to go out and go to a bar and watch a sports game and have fun with the guys. But when a female overdrinks or overuses a substance, there's a lot of shame that comes along with that. And then finally, with substance use with women, again, we need to be looking at things besides physical markers, which people tend to rely on. A lot of our women will come into treatment and their disease is very progressed, but they've been able to hide it quite well. The other part with substance use treatment in general is really looking at what recovery is. The term recovery has come a long way. Part of what we talk about with our families is providing education around what recovery looks like. And it's important for us as the provider to be thoughtful about what recovery means. For the women specifically, recovery means a lot of different things, right? Recovery not only from substance use disorders, but also from their mental health disorders, from a general position of well-being. When we think about recovery for women, we're especially looking at what does their connections with other people look like. A lot of the women that I have talked to will say that part of their support group and part of what has sort of kept them afloat has been that support system. And if we look at the way that women's brains are wired, they're wired for connection. Women more than men need connection. And so when we think about the recovery process, we're looking at traditional 12-step programs. I think though that there's a nuance for that with women, in terms of having a sponsor, sharing at meetings, that's really uncomfortable. Helping families to understand that just because their partner or their mom went away to rehab for 28 days, it doesn't just stop there. So really being aware of when we're talking about recovery specifically with women, we're looping in how does that involve the soccer game on a Saturday morning? How does that involve being available for school events and for sort of the management that women generally take in a household? It's important to understand other recovery models. A lot of the women that are sort of more high functioning or executives, they really respond well to SMART recovery, which is more of a CBT based motivational interviewing, perspective on recovery. They've done really well with that. We're looking at things like Celebrate Recovery, Women for Women, and then, Dharma or Refuge Recovery. But with the women, it's important to give them many options in terms of what the recovery process is going to look like, so that they can be flexible and they can feel a level of empowerment in the recovery process. The other thing that we have found to be very helpful and that has been shown effective is when we're talking about recovery with women, we are also helping them to be aware of what realistic expectations are. So, I've worked with lots of women and, traditional 90 and 90 is what's recommended. For a female, many women, if they miss a day, that is incredibly difficult for them. So really working with women, okay, so what is your recovery plan going to look like? What is your wellness plan going to look like? Might that include, therapy 3 times a week? Might that include 12-step recovery meetings or other support meetings? And how do you allow for some flexibility and some grace in that also? Because what we certainly don't want to do is set the women up that, if they miss one recovery meeting or they miss something, that it sets them up to fail and really puts them in a position to be beating themselves up. So, working with women to kind of come up with a plan of what that first, several, weeks or months are going to look like in recovery is going to be very important. And then finally, asking them, what does recovery mean to you? For many, it's putting down the substance, the chemical or the drug, but then is there other pieces of recovery like balance, which is, for a lot of women is a very challenging concept. Is there a piece of self-care that comes into that? And a little later, we're going to talk about what does self-care look like during COVID and when you're trying to manage all these different responsibilities. Does recovery mean asking for help? And how do you start to do that? How do you practice with people that are safe? That's one of the benefits to being in group therapy. You can start to ask for help from other women. A lot of the women that come into treatment, their first thing that they say is, I don't like women, I don't get along with them, I like to hang out with the guys. And so it's a challenge for them to start to build some of these recovery relationships. Just some facts about women, which I always think is interesting. Women can use smaller amounts of substances for less time before they become addicted. What we know is women's bodies process and metabolize these substances differently. Our women come in very progressed in their diseases. And that doesn't mean that they're necessarily having significant medical issues, but their family issues, their work, employment issues, emotional problems, they're very progressed. In general, women have more cravings than men. One of the things that's been very interesting is doing pharmacological testing with our patients to figure out which medications are going to be most effective for them, which ones their bodies are going to respond best to. So we've been able to really work with some of our women around, is it naltrexone or Vivitrol or Camprol, is that going to help with the cravings? With women, also looking at what emotions, what are those thoughts that sometimes precipitate or drive those cravings? And when we look at the therapy that's effective for women, we're really kind of looking at what are the beliefs, what are the thoughts, really kind of that CBT model that either prepares them better to manage their cravings or that set them up to sort of be more vulnerable to the cravings. Women are more likely to go to ER or die from overdose. Women often are, who are the victims of domestic violence, are at a higher risk. And you're going to kind of see that theme throughout, women's barriers to treatments, what is effective in treating them, co-occurring disorders. There's a big relationship piece. And it's been interesting with the COVID quarantine about how that relationship piece has become more of a treatment need for our women. We've had a lot of women who have said, either I traveled a great deal before COVID or my partner traveled a lot before COVID. And now with the quarantine, with kids being at home, with more and more work happening from home, they're finding that the level of stress in their house is very high. And that perhaps they're interacting with their partners more than they have, in the last 5 to 10 years. And then finally, with women, again, more so than men, there's a lot of shame that comes around fear around loss of custody of children, divorce, death of a partner. And whenever I talk about these things, I always like to be clear that it doesn't mean that these things don't happen for men, that they don't have shame, that they don't have fear around losing their kids. But from a cultural standpoint, women are really supposed to be the ones that kind of are the primary caregivers in general. They're the ones that are supposed to manage the family's anxiety and make sure that everything is sort of functioning productively, I guess. And so, there's a lot of fear that once they get honest or they kind of get discovered, that there's going to be judgment from the other people in their circle or in their communities. Some of the signs and symptoms, and I know we got some previous questions, and these were some of the things that were being asked is, are the signs and symptoms of substance use different in women? And one of the things that I always think about is more of these subtle signs. So there's obviously the overt ones, right? There's people clearly being intoxicated. There's clearly shakes in the morning that people have. There can be changes in color and, marks on their body they didn't previously have. But with women, what we tend to see is in terms of their physical signs, for women that had, sort of a regular hygiene routine that, would shower every day, would brush their teeth, would get dressed, we start to see that start to fade away. When we work with the women and we look at what did their relapse process look like, that's one of the first things that they'll say went, is that their hygiene started to suffer a bit. When we look at women, we look at weight loss, unintentional weight loss or weight gain, changes in weight, and then obviously we start to see medical issues. Some women, might have gynecological excuses for their medical issues. They might be able to make some other excuses for them. But as the substance use progresses, we start to see them with increased frequency. Emotional signs, one of the things that we see is sort of a lack of connection from relationships. Maybe somebody who is very involved with their church or with their children or with some other organization, their partner, we start to see them begin to pull back. We see an increase in depression. Again, especially with COVID, a lot of the women that we've seen come in over the last 6 months or so have reported an increase in their mental health symptoms. So more isolation, as I talked about, that disconnection from family, friends, other social supports. And really, when we think about some other physical signs, you might see oversleeping, eating, things like that. We tend to see an increase in anxiety. And I know, a little later, we're going to chat a bit about what's normal, quote unquote, normal anxiety versus unrealistic anxiety, unrealistic expectations. The other thing I would say is that I think a lot of women will capture anxiety, insomnia, difficulty sleeping. And what we know is that sometimes that's actually withdrawal symptoms happening. So if I have a female who says, I wake up every night at 2 o'clock in the morning, we'll start to look at what is actually happening for them. Is it a withdrawal process versus an anxiety process? And then, as I've already talked about, this isolation, this lack of purpose, looking at how did you let hobbies go? Or are there hobbies that you started to have that more revolved around substance use? Family relationships for women is such a delicate topic. We have a family education program that, we really help the families to understand the substance use part, but really the other part of that is how they're going to take care of themselves. So, if how are they going to start to set boundaries, which is always an interesting conversation in itself. How do they manage their own anxieties? And then with the women, we're really working with them on how do you ask your family for support? It's interesting when we have a woman come into treatment who's sort of used to managing it all, whether they are a professional working outside of their home, whether they're a stay-at-home mom who's sort of managed everything. It's very anxiety producing for a mom to come into treatment. And it's a couple of things. The first one is they're not going to do it right. They're not going to do it the way I would. And we really normalize that because they're probably not. But when we dig underneath that a little bit, what we find is that for many women, there's a fear that their family is going to be able to get on without them. So you might have another family support person, or they might have a partner who is actually more capable and more willing to be supportive than our female patient was aware of because they've just always done everything. There's been some recent research about how for many women, anxiety comes out in anger. And really at the base of that anxiety is fear, is concern that things aren't going to look good or they're not going to go as well as they would have, or they're just feeling out of control. We use a lot of mindfulness and really helping people to stay fully present in this moment, and really be aware that, you can only control what's right here in front of you. We're not trying to invalidate feelings or, shove them down, but let's talk about what's actually underlying the anger, the control, the anxiety. The other thing that's interesting with the family piece is that once women get into recovery, sometimes it just shifts for the families. Because we're asking them to go to therapy, to go to meetings, to practice some form of self-care. And that can also be uncomfortable. We talk about, mom guilt all the time. So we'll kind of loop back to that one. Loss of interest in hobbies, friends, and occupations. One of the things that we see is that things that, would have normally been taken care of. So being at the meeting on time or even early, coming into the office if instead of working from home, if they have that option, lunches not being paid for, permission slips not being signed, things start to fall through the cracks. And those can be, oftentimes our women can easily explain them away. But once we start to see a shift in those behaviors, that's an indication that something might be going on. And then finally, a disconnection from self-care. I think self-care is something that we always say that people need to have, and being realistic about what self-care is going to look like right now. For some women, when they hear you need to have self-care every day, that just pushes their anxiety through the roof because they're feeling like, I already have so much on my plate, I can't put aside an hour for a spin class or a yoga class or to go for a walk. So a little later, we're going to talk about how do we break that down and how do we have these moments of self-care throughout the day instead of putting this emphasis on, this big chunk of time that for many people just isn't reasonable. So some of the barriers to treatment for women, it's been said that only 8% of addicted women seek treatment. And there's a lot of reasons for that. The biggest one often is kind of these interpersonal barriers. There's a lot of shame for women. Again, there's culturally a belief that, women should, sort of have it all together, not ask for help, be able to do everything. And so it's a big risk to ask for help. And that trust that other people are going to be able to help support the business or the family, that there's going to be other people that are going to be able to manage things effectively. Again, with COVID, though, it's been interesting because there's been a number of women who said, if my partner weren't home, if my parents weren't home, if my kids weren't home, I would not have been able to come into treatment. The other thing that's been very interesting is sort of women's cover has been blown, for lack of a better word. A lot of women will use work or parenting responsibilities as ways to manage their drinking or their drug use. And so they might say, I'm not going to drink until after I pick my kids up from school or until after I complete this task at work. But now they're being able to work from home. So I was working with a professional female who, historically her pattern is she would drink after work, about 5:30, totally acceptable, it's happy hour. And then what she found is that when she was working from home, she would complete all her tasks by about 11 o'clock in the morning. And then that freed up her time, or she didn't have as many responsibilities, I guess I should say. So she was able to start drinking earlier. The moms that I've worked with in the recent past year have said having school at home and not having extracurricular activities and not being able to, go do as much, they've been able to start using at an earlier time because they have less of those external parameters on their substance use. Sociocultural barriers, there's a lot of stigma for women in terms of their asking for help and needing to take time away from their families. Some, women have been called selfish and self-centered. There's been times where, from a professional standpoint, women have been asked to check their emails and to still be involved in work, even if they're taking time to get themselves better. There's certainly a disparity in services. Part of my role here is I oversee our teen female program, and there's a huge disparity between facilities and programs for teen males and teen females. Even in terms of women's treatments, having a program that is specifically designed for women, that is addressing those issues that affect women, that is using 12-step literature that is specifically written for women. It doesn't always happen that way, and there are lots of programs that kind of do a one-size-fits-all. In terms of structural policies, this is again an issue for most women who have children. Of what do I do with my kids? How do I get them supported while I'm in treatment? And again, that could be, I'm going to IOP at night, and who's going to help me get my kids to sporting events? I think it was also, when we look at some of the decisions that have been made around COVID and working from home and quarantining and some of the policy that developed, looking at how many of those are written by men versus women, and how does that really impact, what impact does that have on women's mental health? And then finally, there's systemic barriers. Is CYS going to be involved? Children Youth Services, am I going to have my kids taken away? Am I not going to be able to do the soccer, carpool for my kids based on these substance issues? So there's certainly a lot of barriers that women face coming in, and those are just the ones that sort of that are more externally driven. But if we look at the internal barriers that women have, they think about being away from their families for 30 days or 3 months. They think about their young children forgetting who they are. I have had women who have missed major milestones with their children. And we've had to talk about the sadness around that, the guilt around that, the shame. There is fear of women coming into an all-female unit. I'm really starting to build those connections because, most women, I shouldn't say most, some women have not had great relationships with other women. And so that's a barrier that internally, helping them to overcome. Mental health and substance use in women, I would say the majority of our women have a co-occurring disorder. They're more likely than men to have co-occurring disorders. A lot of our women will come in and they've had some sort of trauma happen to them, whether it's physical abuse or sexual abuse. I talked earlier about some of the interpersonal violence that they've experienced. Many women who come in to treatment, again, in inpatient or outpatient, one of the themes that we see is they want to focus on their mental health disorder. They want to focus on their anxiety, their depression, their PTSD. And there's this belief that if I just get these things under control, I'll be able to use normally again or without problem. And so for a lot of our women, we're helping them to understand that in order to adequately address those co-occurring issues, we need to help you to abstain from substances. We need to give you the skills to manage your anxiety, your depression, your PTSD symptoms, your behavioral addiction symptoms, so that you can effectively kind of get through life without going back to substance use disorders. We have a trauma program, and a lot of the women want to talk about their trauma. And we'll say to them, we're actually not going to talk about your trauma at this phase of your treatment. We want you to build the skills through dialectical behavioral therapy, through cognitive behavioral therapy, through mindfulness-based stress reduction, so that when you have symptoms, you can manage them without looking outside of yourself. With COVID, we've seen a large increase in anxiety with our women. And it's a lot of the unknown, the things that are outside of their control. It's trying to manage the family's kind of emotional temperament also. Some of the things that women have done historically to help manage their co-occurring disorders, some of the things that they've done for self-care, including going to the gym or going outside to yoga or going for a walk, they've not been able to do. And so what we've seen is an increase in those symptoms, which may or may not be related to an increase in their substance use. With women, we see a lot of eating disorders, and they're, as a treatment world, I think people with eating disorders probably get bounced around more than anybody else. Certainly the many eating disorder programs are going to say you need to address your substance use first, and the substance use program is going to address your eating disorder. I think we've come a long way with that, but there's huge disparity still in terms of people who have the co-occurring eating disorders. And, in a treatment setting, that's not always, recovery from an eating disorder isn't always, supported in a great way from their peers. Even some of the dining room setups in terms of buffet style and sort of access to food and things like that can be very difficult for people. However, what we really look at is, in order to adequately address those other issues, we need to have you put down the substance so we can help determine what substance related and what sort of an organic, true, individual substance or mental health issue. So treatment needs for women, I think we talked a little bit about what some of the barriers are, what some of the trends are, signs and symptoms, the mental health piece, and all that really ties into the treatment needs for women, right? So one of the first things that we look at is really a program that can address sort of a multitude of issues. Treatment for women is not one-dimensional. There needs to be the psychiatric or psychological component that's really looking at, is there a trauma history? And if there is, how do we best address it? Helping to differentiate between some of those co-occurring issues that might be related to substance use versus a standalone. The women have really appreciated the pharmacological testing and them being able to kind of get those results back about what medications are going to be most effective. With the women, one of the biggest treatment needs for them is to really feel like they have a supportive environment, that they can take risks with their peers and practice new skills. And again, what we know about women is that we need connection. We need to feel connected with other people, and really looking at, how do women begin to connect with themselves? How do they take time when they're in their therapy sessions or in treatment to be able to pull back from their role as mom, as professional, as partner, and look at the core at who they are? That's tough for women. So, really looking at what they like and what they don't like, beginning to assert themselves in a healthy way with their peers. Part of what we look at is the 12-step, self-help programs, right? So whether that's 12-step, refuge recovery, celebrate recovery, women for women, we talk a lot with our women about, surrounding yourself with women who are going to empower you and hold you accountable. One of the things that's important for women to understand is that, we need to have support systems around us that are going to hold us accountable, that are going to be operating within our value systems, that are going to be supportive. And those women are out there. A lot of women believe that all women are, kind of catty and not genuine, but it's been amazing for me to see kind of pockets of women stay sober. And what we have seen is that those women that engage with other women in recovery, who are living a healthier lifestyle, their chances of staying sober and staying healthy increase exponentially. We talk about women's meetings with our women, going to meetings where you can talk about when you've just had it with your partner or your kids. And there's going to be another woman in that room who is shaking their head and can relate. The ability to be honest with somebody. One of the things that I think is important for women to know is that we have a lot of shame around sort of intolerance with our family members, or not kind of losing it or not being our best self with our kids. And some of the most powerful moments I've seen is when somebody shares that and there's someone else in the room who's nodding their head and is like, I did that last night too. So to sort of normalize some of the range of emotions that women are going to have and not pathologize it or not have stigma around it, but it just is what it is, right? As long as we're not hurting people, we can still be angry and frustrated and scared and sad and all those different things. We talk about female sponsors for women, especially in 12-step programs. And I think in terms of treatment, having women who are in their own recovery process, again, whether it's from substance use, compulsive behaviors, family relationships, Al-Anon, whatever that looks like, but that there are other women who can, kind of provide some positive mentorship for people who are early in this process has been very important. We need motivation, and that often starts as external motivation. So I'm doing this for my employer, for my kids, for my family, but then really looking at what are those internal motivators? How does your value system guide the decisions that you're making? And also with that motivation comes, how do you have motivation to take care of yourself? Sort of that, put your air mask on first mentality. And that is very difficult, to be able to really look at self-care as kind of putting on your air mask first. With addiction treatment, we're looking at individual and gender-specific groups. At Caron, we have a relapse unit for folks who have had previous treatments or previous periods of sobriety, and they've relapsed. They don't need education around what a 12-step program is. They don't need education around disease model of addiction or attachment model of addiction, but what they do need is to kind of dig underneath and what kind of took you back out. And for a long time, we did that together. It was a co-ed. And recently, we separated it. And what we have found is that for women specifically, what they need to talk about is trauma pieces, the shame of being a mom in recovery, or a mom in addiction. There are many of women who, on our relapse unit, who their kids only knew them sober. And then when they've relapsed, their partners saw a whole different side of them. And so they need a safe place to be able to talk about that. With women, we're talking about shame, but we're talking about it as it relates to women. We're talking about post-acute withdrawal symptoms, but we're talking about specifically how do hormonal changes impact that? How does, family stressors impact that? When we're looking at some of the step work that we're doing with the women, we're really tailoring it more towards a female perspective. And again, we're even looking at what does recovery mean from a female perspective? I think that when we talk about gender specific, it's not just sort of this like overview, but how are you a professional in recovery and you're a female? And, how do you, kind of stay within your recovery principles and, still be that really, kind of assertive go-getter that you need to be. Addressing co-occurring issues. Again, we're looking back at anxiety, depression, trauma symptoms. And a big piece with treatment needs for women is tolerating emotions. One of the things that I'll hear family members say often is she's very emotional or she's sensitive. And here's the thing is that for women, it's almost looked down upon to be emotional, right? To be sensitive. And so what we want to work with our folks on is how do you tolerate your emotions? We do a lot of DBT and the women really respond well to that. So we're looking at, how do you validate your emotions and how do you set yourself up to manage difficult situations in the best way that you can? So we're looking at what are your vulnerability factors. And that's going to tie into self-care. That's going to tie into being honest with where you are, being able to ask for help. But we're looking at, if you have an emotion, what purpose is it serving for you? The emotion itself isn't necessarily problematic, but the way that you express it can be difficult. So helping people not to numb their emotions, not to be dishonest about their emotions, but be able to express them in a way that people are going to be able to hear and they're going to be able to be responsive and respectful to. And then finally, we're looking at developing healthy relationships. Again, I've been doing this for a long time, and so the most rewarding experiences for me is, when I see two people have a genuine vulnerable connection that is not based on what someone can give someone else, but it's just truly being present for somebody. And, Brene Brown talks about that a lot in her work, that, one of the best things that we can do in terms of having healthy relationships is not try to fix it, not try to take away somebody's pain, but just be fully present with them. And, we talk about that even with our women, our female patients who are parents, to say that, it's difficult as a parent not to want to take away your kid's pain. But part of what we're doing is we are developing the ability to sit with somebody in their pain and not try to make it okay. But developing those relationships that are really give and take, that are really, honest and genuine and fully transparent. And then finally, if we look at some of the ways that women can cope, right? Part of this is, through having a plan. Who are those healthy relationships going to look like? Who are those supportive people going to be? Who are the folks that you can go to and can have a non-judgmental relationship with them? How can you start to develop some of those healthy relationships? For some of our women, we're looking back at, what does a healthy relationship even mean to you? How do you have a support system of people who aren't just going to sort of, this lack of a better word, like co-sign your stuff, but people who are going to challenge you and are going to hold you to a higher level of accountability. The other piece of this is really the mindfulness pieces of life. Mindfulness and being mindful has been sort of a buzzword, in the last recent years, but we're really working with women about what does it mean to be truly mindful. Is your head where your feet are? How do you kind of practice that skill of being in tune with what's happening in your body, with what's happening in your heart, and not judging it, but just having an awareness about it? A lot of our women, we're asking them to step back into the world, be fully living, right? And what does that mean for different people? That might mean, for the professional who's been out of work, integrating back into work. How do you have support systems at work? Most professionals won't come back into work waving their recovery flag. However, it's important to have some allies. When I'm struggling, who can I go to? How do I find the meetings that are going to be most supportive for a professional? Confidentiality issues in meetings, things like that. So really looking at what does it mean to have a recovery process. And then also, it says on here, having a fulfilling life, and really looking at what brings joy. How can you implant those things throughout the day? And how can you be of service to other people and give back? Our women are eager always to come back and speak to our current patients. They're always, we have a one particular alumnus who every Christmas she sends a package, and in the package is handwritten notes. And sometimes she'll do the Serenity Prayer on a bookmark. And so those are the ways that we start to give back. The other thing that I really think about with women in terms of giving back is teaching our kids and our family members sort of the recovery principles. I think that is one of the ways that we give back to our kids and our families. We teach them about tolerance. We teach them about patience. We teach them that people are going to make mistakes. I think back to some of like the personal examples in my life with my kids where they've seen like a corrective moment where perhaps I have, not presented my best self, and to go back and say like, look, you know what, that was a mistake. That was a miss. If I could have handled this differently, I would have handled it. Our kids need to see that it's okay to make mistakes. The last piece I want to talk about is really just sort of this managing COVID stress. There's a lot of research right now around mental health being significantly impacted for women more than men. And looking at starting to do some research around that, around why is it more difficult for women than it is for men. And, I think part of it is that women in general, and this is a broad statement, and it's not going to be true for every situation, I understand that, but in general, women know the school schedule, even if they're the professional, if they're like the working mom and perhaps there's a stay-at-home other parent, dad or partner, mom still knows the schedule. Mom knows where the Christmas presents are. Mom knows what the Halloween costume is. Mom knows, you know, what they like for lunch, what they don't like for lunch. And so with COVID, there's been this added uncertainty, and our kids are looking to us to guide them in that, to you know, sort of manage our anxiety. And so this has just been a very interesting time for parents in general, I think, but specifically for women, being realistic about expectations of yourself and of others. I know a lot of women will get frustrated with their partners because they're not doing things right or they're not feeling supported. But part of it is our expectation realistic? And are we communicating our expectations to the people around us effectively? There have been times that women specifically, have expected their partner to mind read, and they can't. So to say, like, look, I need help with dinner tonight. I need help, you know, getting the kids ready so I can get to work on time, or I need help with this Zoom meeting because I have something else going on. So being honest with where we are and what we need help with. My biggest thing that I have said to women over and over during this time is to break self-care down into manageable pieces of time. So for many, it's unrealistic to expect that you're going to get an hour yoga class or an hour spin class in. But it might be more realistic to say, I'm going to do 10 minutes of mindful meditation in the morning. I'm going to enjoy my coffee uninterrupted. I'm going to meal plan for the week, right? Like, these are all sort of more realistic self-care options. And also, how do you show what appropriate self-care is to the people around you? You know, might it be that you go for a family walk, right? And or you have a family dinner, or, you know, you take 20 minutes to get a hot shower or a bath. The other thing with self-care is, if we're able to do most things mindfully, it sort of gives us that sense of self-care. So what I mean by that is, when you're at dinner or you're at breakfast, being fully just in breakfast or dinner, right? Like, not having your phone on, not talking about what's coming next. One of the things that has been interesting for me during this time with my own kids has been really saying, okay, we are right now in this very moment. I cannot worry about what's happening next. Right in this moment, we're doing this one thing. And they've even started to say that, like, when I get down the bunny trail, they've said, Mommy, we're in this moment right now. We're going to worry about that when it gets there. So that's been sort of that modeling piece that's been very helpful. Also, you might have to get creative about what self-care looks like. You know, especially for women in recovery, we spend a lot of time talking about what does recovery, self-care and recovery look like? What does intimacy with your partner in recovery look like? You know, before it might have been a glass of wine at a campfire or over a dinner. And now, how do you start to develop a new self-care routine, and even like a couples care routine? Taking time to just fully connect with the other people in your life. Asking for help, which is like the biggest, you know, everybody should ask for help, but it's very challenging. So one of the things that I always encourage people to do is know those people in your life that you can go to ask for help. The people that might not say yes every time, but that you start with safe people. And I usually suggest start asking for help when a problem is small as opposed to when it's big. So when you start to feel the anxiety, when you start to feel the stress, when you start to feel overwhelmed, asking for help then, before it like kind of blows up and that it's more difficult to ask for help or accept the help that's being offered. Be honest with how you're feeling. Again, anxiety comes out in control and anger for women. You know, being able to have a trusted partner or support person that you can just be honest with how you're feeling. And for some people, that might be through journaling, that might be through prayer, through meditation, you know, just being able to be vulnerable and take those risks. And then the final two, just be gentle with yourself. We're all in uncharted territory right now. You know, people keep saying it's the new normal. And I think that for women, it's very hard to feel like there's like things are really out of control and sort of out of a normal routine. And then finally, have some grace, tolerance, and patience. You know, I think that for the folks we work with, for the other women in our lives, for the men in our lives, for everybody, because, you know, we're all trying to sort of navigate this in a different way, and really just having some grace. You know, I think about the work that people are doing in terms of mental health at this time, in terms of education, professional growth, having some grace and some patience and tolerance.
Thanks so much, Erin. That was great.
Sure.
Now we're going to have some questions that were submitted through the registration process.
Okay.
And the first question is, how can women deal with the guilt of not being able to make things better for family members?
Yeah, I mean, I think that's a great question. And where my mind initially goes to is, part of guilt is being able to, they talk all the time, shame is a reflection on self, guilt is a reflection on behaviors. And I know that we can't make things better for people. However, part of that though is sitting with people in their pain. I'm currently reading a book about parenting as a heroic journey, and it really talks about our ability to just sit with somebody when they're in pain and not need to make it okay, and to be able to say, like, look, I'm scared too, I'm uncertain too. And moms specifically are going to say, I can't say that to my kids. But here's the thing is, we are the people that teach our kids emotional language. We teach them emotional resilience. We teach them emotional responsibility. And it's sometimes okay to say, I don't know, or to say, it's really difficult to not know, to help kind of come together with people and process, like, how can we as a family unit or as a business come together and work through some solutions? Are there ideas that they have that maybe they're unsure of or uncertain of? So I guess the long and short of it is, sometimes it's okay just to sit with somebody and model uncertainty and not have to kind of self-destruct over it.
Thanks. That makes a lot of sense. The next question, how can we help women discern what is a normal level of anxiety and what is not normal?
Yeah, that's a great question also. I think that a normal level for anxiety varies from person to person. My ability to tolerate discomfort and to tolerate uncertainty might be different than yours, Martha. But, so figuring out what our kind of normal level, our baseline is of our ability to tolerate it. But really what I start to look at when it becomes problematic and how we can help people discern what's normal versus abnormal, I guess, is how does it impact your ability to function, right? So, in DBT, we talk all the time that all emotions serve purpose. And so anxiety serves a purpose. It tells us when we're in danger. It tells us when we need to take action. It tells us when maybe we're, not fully emotionally capable. But when it becomes a barrier to sort of showing up for life, that's when I would say that it's not over the top, but when it's maybe problematic. But for me, the biggest thing with what's normal versus not is anxiety is going to come and go. There are going to be times where I'm more anxious and less anxious. And I'm sure through this pandemic, there have been women's anxiety that's been very high. And then maybe 3 days of sort of normal anxiety, daily anxiety. We needed to function. We needed to promote change. But what I would say is when it's high or when it feels out of control for a period of time and there's sort of not those moments of, okay, calmness, then that's when I would say it's probably more of a problematic piece.
Thanks. With COVID-19 putting so much added stress on mothers, has there been an increase in high functional alcohol and drug abuse?
Yeah, I think that, a lot of the women that we would have previously called high women or high functioning substance users, they have a lot more of external controls on their drinking or drug use or substance use. And that those external parameters have certainly changed. So again, like going into an office, needing to be responsible for the carpool or picking kids up or volunteering in the school. I even think some of the social situations that professional women may have found themselves in where drinking would have been more acceptable, those situations have changed also. So whereas I may have been out to a business dinner, and I was acceptable to have, several glasses of wine, when I'm at home with my family, it's less acceptable.
Thanks. So we spoke earlier about leaving children being a barrier to seeking treatment. What type of communication do you allow patients to have with their kids while they're in treatment?
That's a great question too. So I would take a guess that most treatment facilities at one point offered visitation, and with COVID, not offering visitation, is more the norm. So at Caron, historically, we would allow for a Sunday visit. Now, since March, we've not had visitors on campus. But what we're doing instead is allowing for FaceTime with our mothers and fathers and their children. And we also have daily phone calls. It's been interesting to see how, for the women specifically, I think that they're, again, because they have some supports at home now that they may not have historically had, with partners being at home or grandparents being available, that they're actually better able to focus on themselves during this time because they know that their kids are being taken care of by other people. So, certainly the FaceTime, and then also, especially with moms and their kids, trying to tease out how much is for the mom's well-being and how much is for the kids' well-being. So we do take that into consideration, that if it's going to upset their kids to have a, once weekly or twice weekly FaceTime, we'll kind of talk them through, does that make the most sense?
Thanks. What screenings are recommended for women to discern if they have a substance use disorder?
So I would say for women, obviously there's the medical, like, physical and things like that. But to me, what I've seen be most effective with getting women into treatment is their ability, is some of the family reports, quite honestly. If their partner or children or employer is recognizing problems, that might be, one of the ways to get them into treatment or to screen for it. I think in general, self-report is very difficult for substance use. Because there is a nuanced way to ask questions. Are you taking medication as prescribed? Yes, I am. And I'm drinking a bottle of wine after I take it, right? So there's always nuanced ways to ask these questions. But I think for women, there's a lot of benefit in the collateral reports also. As far as I know, there's nothing specifically just for women.
Perfect, thank you. And we have time for one of our live Q&A questions. How can clinicians help our clients explain their recovery process to their children?
This is great. There's so many good questions. So one of the things that I've used for younger kids, that my biggest thing is always, I tell our parents, don't tell them that you're going to the hospital or that you're sick and you're going away, because then every time you get sick, they're going to think you're going away. One of the things that's been really helpful for parents of younger kids is, without a doubt, there's a kid in their class that has an allergy to something. So, a peanut allergy, strawberry allergy, whatever. And so we've sometimes said, tell them that you have an allergy and that you needed to get medical care for that. We have talked with kids about, or parents to talk with their kids. They've usually seen symptoms of the substance use, even if they've not seen the drink or drug, they've seen the symptoms. They've seen oversleeping. They've seen inconsistency in mom or dad's responses. They've seen them missing things. They've seen them oversleeping. So to be able to say to kids, like, those things were not allowing me to be fully present or for me to be the best mom or dad I could be. So I'm taking time to get myself well. One of my dreams ever is to do a research study on how being a child of a parent in recovery impacts the child. There's a ton of research about how parents and active addiction negatively impact children, but I'd love to see how having a parent in recovery who's being accountable, who's practicing spiritual principles, who's being authentic and vulnerable and, kind of involving them in this recovery process impacts their life in general.
Great. Thanks so much again, Erin, for presenting.
Glad to be here.
Today. And thank you everyone for joining us today. As a reminder, today's presentation is eligible for 1 continuing education credit. An evaluation will not come up directly after the webinar, but you will receive a link to your email. And upon finishing the evaluation, you'll have immediate access to your certificates. So next week, we are actually pausing our webinar series, but we'll be back on Tuesday, September 8th with a new topic and speaker. In the meantime, we have some exciting news. We're proud to announce 2 virtual continuing education opportunities that will be coming up in October, and we hope you'll join us. Caron is actually partnering with ACM to host their Fundamentals of Addiction Medicine workshop. This innovative and highly interactive workshop will provide a comprehensive overview of addiction medicine and how to screen, diagnose, and treat and refer patients with addiction. We will also be hosting our 5th annual Addiction Medicine Symposium online as a 5-part series. And leading experts in the field of addiction medicine come from across the country. They'll share the latest in current and future treatment possibilities. Both of these opportunities have been approved for AMA PRA Category 1 credits. So please check with your licensing board to confirm if these credits are accepted for you, and watch your email for details on how to register. And last thing, please reach out to your local regional resource director anytime for any additional information, resources in your area, or questions regarding admissions to Caron's programs. Thanks so much, everyone, for joining us, and have a great afternoon.